My name is Robert Sanderson, and I'm the project lead of the Northern Ontario Climate Change and Health Collaborative. Working on the ancestral traditional territory of First Nations, Métis, and Inuit peoples in what is known as Northern Ontario, our collaborative consists of representatives from all 7 Northern Ontario public health units. Through the support of Health Canada's HealthADAPT Program, our collaborative network was formed to develop a deeper, context-specific understanding of how climate change will impact the health of people living in Northern Ontario and prioritize appropriate, evidence-informed action to minimize the negative health impacts of climate change. Recognizing the complex and often intersecting ways in which a rapidly warming climate can impact our health, the collaborative chose to conduct regional vulnerability and adaptation assessments under the guidance of Health Canada. A Vulnerability and Adaptation Assessment, or a VNA, is an organized and rigorously tested approach towards assessing which populations and geographical areas are most vulnerable to different kinds of climate-amplified health impacts, as well as the capacity of health systems to manage these. This process aims at identifying weaknesses in the system that should protect population health, as well as identify adaptation options to strengthen the resiliency of our health systems. For many health units in our collaborative, conducting a vulnerability and adaptation assessment is the first step towards meaningful climate and health action, and were completed to serve a variety of purposes, including to help us gain a deeper understanding of climate-sensitive health information, integrate local understandings to further knowledge of regional health risks, and assist health units in comparing current and future changes to prioritize health risks and protective action. To truly deepen our understanding of regional climate change and health impacts, our VNA assessments consisted of 3 components. 1, a comprehensive literature review and analysis of regional climate projections utilizing a collection of climate models and potential climate scenarios. 2, purposeful engagement with over 100 key community partners and leaders, including regional governments, health centers, Indigenous councils and leaders, environmental nonprofits, and key service providers. And the last component was an integration of historical health data and health indicators to identify future health risks and guide the prioritization of adaptive action. As Northern Ontario continues to warm, health risks will continue to increase. Our project has identified a number of impact pathways in which climate change will affect not only individual health, but also the structures and services which our health system depends on. This work has yielded many important insights, including key takeaways that climate change is already negatively impacting the health of Northern Ontarians. The impacts experienced in Northern Ontario are unique to our region and must be addressed through a localized lens. These impacts are disproportionately experienced, particularly within racialized, marginalized, and low-income populations. However, key strengths and resiliency enhancers exist within Northern Ontario populations, including strong community connection, respect for the natural environment, and an acclimatization to adverse weather and the need for emergency preparedness. Collaboration among regional decision makers is necessary to take meaningful, equitable, protective action now to minimize the risks and protect health. All action taken to reduce causes and impacts of climate change will have immediate co-benefits to health. See, as demonstrated during the COVID pandemic, public health capacity is incredibly stretched. This is particularly true within the Northern Ontario context, and understandably often leads to the prioritization of more immediately perceived health threats. Funding from Health Canada has not only supported the formation of our collaborative, but has helped sustain momentum and the prioritization of climate change and health work when otherwise organizational engagement wouldn't be possible. Our project has aimed to build and sustain the capacity of the Northern Ontario health units to protect health by identifying and adapting to the risks posed by climate change. By way of completing regional vulnerability and adaptation assessments, our project has incorporated regional climate change projections, health data, and localized perspectives to inform and prioritize policy and program recommendations to respond to climate change. We hope this work acts as a stepping stone to further regional understanding of climate change and health impacts, and as a catalyst to prioritize the necessity and the urgency for meaningful action to protect health.